Nursing students, time to talk. Welcome to the Real Talk School of Nursing podcast. I'm your good and faithful host, Michael Smith. Thank you for continuing to subscribe to the show and following us through social media. I have an okay show for you this week, just being honest. So, having said that, I'm going to need help from you to make sure that you're sharing your experiences, asking questions, and giving feedback. Write into the show at realtalknursing@gmail.com or use Facebook Messenger or contact us through Instagram and Twitter. It's really important to make sure that I'm staying in touch with what you need as Pre-Req students, nursing students, and students who are preparing for the NCLEX and also getting ready as new grads. Thank you to everyone who started following us on Instagram, Twitter, and Facebook. More listeners means more and better shows and better content. Make sure to share the episode. That's the most important thing I can ask you to do. I have lots in the works, but for now, let's get the show rolling.
If you like the show, the Real Talk School of Nursing podcast is available on iTunes, Google Play, iHeartRadio, Libsyn Web Player, Stitcher, YouTube, Spotify, and SoundCloud. So, go wherever you download podcasts, subscribe, rate us, review us, write into the show, and smash that subscribe button. Remember, only leave 5-star reviews. That's the only rating that counts to get us noticed by more nursing students. Write into the show at realtalknursing@gmail.com or on Facebook Messenger. You can also join us on Facebook, Twitter, and Instagram. We're building a community of fun, supportive nursing students, and I want you to be part of this crazy nursing school journey.
Okay, so welcome to it. So, this is my Pre-Req student segment, and I want to start off by talking about a similar experience I had to being in Pre-Reqs. I remember when I was in the Army and I had been working for about a year to get ready for the SF Combat Diver course. Then when it seemed like it would never happen, suddenly I had orders. And it went back and forth. Like it seemed like it was going to happen and then it wasn't going to happen. Like the orders would come up and then it wouldn't. And then there are slots, there aren't any slots. It just kept going back and forth and back and forth. And it was really difficult to deal with. But, suddenly, I had them. I can vividly remember my thoughts as I opened the paper orders that were sent to my battalion commander. And the staff officer who was helping me get ready was a really stoic guy. And, even he seemed really excited because this was a really rare school to get. And, even he seemed very excited. And my best friend in college was a guy named Luke. We didn't have cell phones back then, but I remember when I called his room at about 7:30 in the morning, which is not a big deal if you're a parent or something like that, but, when you're up till 2 or 3 o'clock in the morning studying and stuff like that, being up at 7:30, kind of a bigger deal. And I remember calling him, and I said, "Give me your social security number." And he says, "For what?" And I was like, "No time to explain. Just, I need it." And we'd built a lot of trust between each other, and he gave me a social. So I had received a call from the guy who was doing the orders, and he needed my social security number in order to process those orders. So, I was like, "I'll call you right back." I called Luke, and then I called this guy back with both of our socials, and he wrote 2 sets of orders. So sometimes it's not what you do. Sometimes it's who you know. And I just I bugged enough people and got into the right person. He goes, "Oh yeah, I can write your orders. No big deal. Just send me your social." And, and it just seemed that easy. I mean, kind of like the iceberg, you only see, the little tip of success, but, obviously there were months and months of trials and tribulations underneath that. But, there it was. And, so there I am, large envelope, and I pull out 2 sets of orders. And I recall very, very clearly my thoughts. "Holy cow, I have orders!" And then immediately following that, "Oh no, I have orders." And it was like, it was like, a feeling of impending doom. I didn't feel ready. I felt like I needed to do more. I needed to be better. I didn't want to, I didn't want to fail or be sure to fail before I'd even started. And, it was overwhelming, but we got through it, and we got there. And I think there was a point about 5 or 6 days into the pre-dive school, because before we went to dive school, we had to do this pre-dive program, where my best friend Luke, who was my roommate during that school, stopped talking to me. We were hanging up our clothes to dry, and there was like no time for laundry or, other than like rinsing the uniforms and stuff like that in the sink, and then, trying to get them somewhat dry by hanging them up in our room. And we were just getting killed every day. Boat PT, 5 to 10 mile runs with these absolute animals. 3 to 4 hours of pool work in the morning, where we did like breath hold dives and stuff like that. I mean, we could all hold our breath for pretty comfortably for about 3.5, 4 minutes by the end of dive school. And then in the afternoons, we did long distance surface swims, and we were completely wiped out physically and mentally. And for a whole day, Luke stopped talking to me, and I think really regretted giving me his social security number at some point. I think there were like 50 individuals who arrived at pre-dive school, and I think we graduated 9 people. So it was very, very difficult. And then at the end of that, we got our orders to go to school. We arrive, we get set up, and we have 0 week. And everything that we had prepared for the last 6 or 8 months, and certainly through pre-dive school, over the past couple of weeks, was tested and completely done within 48 hours in 0 week. And I think it was at that point that I asked myself, I said to myself, like, oh God, what have you gotten yourself into? Like, I think all of us regretted our decision at one point or another. I think that's very clear. I think it was just 21 at the time, and once 0 week was over, I felt suddenly very unsure about what I was going to be doing. And again, that doubt rolled in hard. There were several West Pointers in my class, a few Green Berets, a bunch of Air Force combat controllers and PJs, or pararescue jumpers, most of whom had all been deployed already. And, here I am, like, never deployed, whatever. And I don't want to say that I felt inadequate, but I most certainly felt a great amount of awe for these people, and felt like often I probably shouldn't be shouldn't be considered in the same room with these guys. And then you come to my instructors. We had several Navy SEALs. I'll never forget their names. Petty Officer Doyon and Petty Officer Thompson. We had one Rangerback guy and one really, really tough Marine Force Recon guy who was literally had legendary status. He was crazy and awesome. The lead instructor was a guy who had been on a wreck dive 3 weeks prior and got hit by a boat coming back up and lost his leg. And 3 weeks later, he's at the school teaching us and killing us. There was one Green Beret who was the pinnacle of what every service member should aspire to. These guys were titans. Inadequate. The word inadequate is inadequate for how I felt. I was in awe of these guys, all of them. So fast forward a decade, and I get a thick envelope from the school where I wanted to attend nursing school. And, this time I was alone. But it was that same feeling, those same thoughts. I've been accepted to nursing school, and then immediately following that, oh no, I've been accepted to nursing school. And I'd been doing all my prereqs for a number of years, and I had to retake a stats class, as my last class was, far outside of their expiration dates. So I finished that in short order, and I was, just, getting ready to start the program. And suddenly all the stuff that I'd done for prereqs were done. They weren't pointless, but, what I was about to enter was going to go so far beyond that. And I felt doubt. I met a few of my classmates at orientation, and I was once again feeling inadequate. My class was 90% women, and I don't think I've ever met a smarter group of people. Surely there was a mistake. They must have gotten my GPA mixed up with all the rest. I felt like I was a complete idiot compared to these people. And all through school, this scenario played out in my head. I don't deserve to be here. I'm the dumbest person here. But I'm here to tell you that you aren't. That doubt you feel can be healthy, and that can help drive you to do more than you thought you were capable of. But don't understand me. It can also be incredibly unhealthy to always be under this level of stress. I remember doing a lesson on thyroid storms. If you don't know what a thyroid storm is, look it up. And I remember looking at the signs and symptoms they presented to us and thinking, I think we're all in a thyroid storm right now. I have all of those symptoms, and for me, all the way through school, I never felt safe. Even, with the last semester, the last assignment, which was subjective as hell, the grade, it was completely subjective. And I felt like the instructor could have, had full power to bomb me, and then I'd have to either quit school or I'd have to get recycled to the next cohort for, next year. Now, okay, let me rephrase. Number one, I would never quit. That's not part of who I am. I would never ever quit. They would literally have to kick me out, clean out, stuff and hand it to me and tell me you can't come back here, because that's the only way that I was going to not make it through. But she could have, my instructor could have totally bombed my grade and I'd get recycled. That's just the way it is. So I think part of the point is these feelings are normal and natural. And I think if you walk into a room where you're the smartest, most talented person in the room, I think you're in the wrong room. And nursing school is going to be filled with highly motivated people. And while you may feel inadequate in some areas, there are going to be areas where others are going to feel inferior to you. And I don't mean that inferiority is good. I don't think you should feel inferior to another person, but you know what I mean. So number one, don't quit school, don't give up, and don't ever feel inferior to another person. Let me tell you, in a clinical setting, I was awesome. I felt like I was really in my element. There were lots of classmates who were great in classrooms and really struggled or never felt comfortable completely in the clinical setting. And, they could still write the heck out of their care plan, so they had great grades the whole time, but the actual person-to-person interaction stuff was a real struggle for them. So the point is, you're not the first person to go through this. Lots of other people feel the same way. You shouldn't have to. We all have different strengths and different weaknesses. You won't be you're not the first person to feel this. You're not going to be the last person to feel this. And you're not alone. You can make it through, and you can make it all the way through to the end if you keep working hard. And, again, once you're doing all the prereqs, once you finish all of that stuff, remember that there's a point to all that. You're going to finish, one class or whatever, and, that's the last step before you start nursing school, and suddenly you're going to realize that the prereqs are over, and now you have to start something. The point of doing that one class or whatever wasn't to finish that class. It was to qualify you to get into nursing school. And that realization can be very difficult sometimes. So number one, I think it's important for you to realize that and lift your eyes a little bit every once in a while. Remind yourself that there is a point to what you're doing, and that there's, your future is on the horizon, and there's better and harder things coming. So, gird yourself, make sure you're ready, and take a longer term approach to problems and how you feel, because the stress that you feel is like, okay, this is a small bump in the road if you encounter a problem. This is a small bump in the road, and, things could get better, things could get worse, but, we're doing okay. So just relax. You're going to make it through it. Just keep working hard and remember why you're there. Are you tired of the same old badge reel? Do you have to wear the same scrub color as everyone else? Are your undershirts boring and kinda stinky after wearing your lucky shirt through 5 in a row 12s? You can wear personality in other ways. Go to badgelady.nerdwear.com and check out her crazy selection. She also takes custom orders on a limited basis. Tell her you're a Real Talk School of Nursing podcast listener. Be nice to her and she'll be nice to us. It might take 2 or 3 weeks for custom orders, and you can probably count on a few days, depending on her actual job schedule, to get your badges shipped. I know you'll treat her like your best friend at clinicals, so go to badgelady.nerdwear.com and order the coolest badge reels out there. Badgelady.nerdwear.com, and tell her you're a Real Talk School of Nursing podcast listener.
You're listening to the Real Talk School of Nursing podcast with Michael Smith.
Welcome back. This is your good and faithful host, Michael Smith, and the Real Talk School of Nursing podcast. This next segment is about the nursing student, and I want to go over something that I discovered about a week prior, actually longer before a week prior to my NCLEX retest date, but I actually started digging into it about a week, maybe 9 days prior to taking the NCLEX. Here's the thing. Regardless of how I got them, I got old recordings of Mark Klimek doing an NCLEX review. It was probably from the pre-2010 era. He was still pretty small back then and even encouraged people to record lectures at that time. Let me be very, very clear. They do not encourage recording now. That's a big no-no. And they shouldn't be shared anymore. And frankly, after listening to them, I think being in person would yield exceedingly better results. But, as they say, it's no use crying over spilt milk. And I'm glad in some way that I found them, because now I can encourage other people to go to Mark Klimek reviews, or Klimek reviews. That's Klimek reviews. So Klimek reviews, and I think they're based out of Ohio. So if you're kind of in that central part of the U.S., and they branch out to a few other states, and I think there's 5 other states they're going to. I think they're doing some in New York and Kentucky and Texas, and so they're branching out. So it is possible to go and get one of these reviews, or do one of these reviews, and I think they're 3 or 4 days, and not live in the state of Ohio. But anyway, okay. So, like I was saying, there are some things that were outdated. For example, when he did the recordings that I had, they were the questions were a little bit different. For example, in a select all that apply or a SATA question. If you ever hear me refer to something as a SATA question, it's a select all that apply. It couldn't be all of them, and it couldn't be one of them. So it had to be more than 2 and less, one less than all of them. And that was so if you had 5 choices, it couldn't be 1 and it couldn't be 5. So it had to be, it could be 2 and it could be 3, but it wasn't going to be 4, or it could also be 4. So it could be 2, 3, and 4 if you had 5 choices, but it wouldn't be 1 and it wouldn't be 5. So that's changed since then, and there's some other things that if you have access to those recordings, there are some things, but there are some things that are timeless. For example, one of the things that he teaches, just to give you kind of a taste, kalemias. So hyper or hypokalemia, potassium. So kalemias, they do the same as the prefix, except for the heart rate and urine output. So, for example, what are the signs and symptoms of hyperkalemia? So if you figured they have a potassium level above 4.5, if you're looking at a question and say, okay, well, this patient has, a potassium level of 5.2, blah, 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 whatever, and then saw a list of symptoms or, something like that, you should expect to see what? So if it does the same as the prefix, except for heart rate and urine output, agitation or lethargy, irritability or somnolence. I can never actually say this word right, so some of you probably will and should laugh at me, but tachypnea, so quick breathing, rapid breathing, or respiratory depression, bradycardia or elevated heart rate, tall P waves, yes, elevated ST waves, yes, diarrhea and borborygmi or constipation, spastic muscles, yes, hyperreflexia, yes, oliguria or polyuria, right? So if it's hyperkalemia and it does the same except for heart rate and urine output, which one's it going to be? So, you can kind of select from that kind of list what the body should be doing, and so it can kind of guide you towards the right answer. So for hypokalemia, remember that same as the prefix, except for the heart rate and urine output. So, if you had a list of symptoms again, lethargy or excitability, tachycardia, yes. Again, the word, I don't think anybody can actually say this right. I'm 100% positive. Bradypnea, so slow breathing, or hyperventilation. Dynamic ileum or constipation. Flaccid muscles or hyporeflexia. Polyuria or urine retention. And then you kind of understand those electrolytes. It's amazing what else you can figure out because you know what's going on with their body systems when their electrolytes are out of balance. And that's, just an example of kind of the stuff that they talk about. So if you look up Klimek reviews, that's Klimek, Klimek reviews, and you can get into one of those classes. And if you can get into one of those classes, I highly recommend it. Sorry. The one problem or dilemma I have is when you should take this class. Like, what is the best timeline for taking this class? Because if you take it early in your nursing school journey, will you really even understand the content? If I took it prior to first semester, like I kind of feel like there would be so much content that would be reviewed in it that I wouldn't have the base of knowledge in order to understand, and therefore I'd kind of get lost. And it's fast moving, so there's a lot going on there. And if you take it in the middle, could the information in the lectures have helped with classes towards the beginning? So that's a problem. If you take it at the end, the lessons would be great for the NCLEX prep, but the way he presents information and actually teaches you instead of just presenting information, I mean, honestly, this could have made so many things so much easier in school. So I'm going to try to get him onto the show. I'd really like to have him. I will apologize for, having listened to a currently not authorized recording, even though at the time that they were recorded, they were allowed. But I don't encourage people to go out. You really should go out and try to take this class. So I have no idea if I can get him on, but I'd really like to. I'd really like to try doing that. He's not a sponsor. Clinic Reviews is not a sponsor, so I'm not beholden to anyone when it comes to promoting stuff. I've used UWorld. I have NRSNG, and, I did for a long time before I started the podcast. Actually, I think it was this podcast. I think it was Ben and Greg in one of their commercials that kind of pointed me towards NRSNG in the first place. But I've used Kaplan, and I've gone to their review class, and finally I have used Mark Clinic Reviews, and they're so amazing, they're so good. So the bottom line here is they're worth triple what they charge, and it doesn't matter when you go to a class. I think it's going to be a big help.
You're listening to the Real Talk School of Nursing podcast.
So welcome back. The last discussion segment, we're going to be talking to the nursing graduate, or, those who are getting ready for the NCLEX. And I want to kind of talk about my NCLEX, like the last, 24 hours or so prior to me taking my second attempt. So if this is the first time you're listening to the podcast, I had already failed it once back in April. And so this was my second attempt, and we're going to talk about, the 24 hours preceding or so. And so if we back up to the night prior to the NCLEX, I stayed in the metro area, and I got, an okay night's sleep. But, regardless of what the type of sleep that I got, I didn't have to get up at 5 o'clock in the morning to drive into the metro area for an 8 o'clock appointment. So, at least there's that. And if you are outside of the metro area, or you're more than an hour away from where you're going to test, it might be worth staying in the metro area. So that's what I did. And, even so, I think I randomly woke up at like 3:30 in the morning. And of course, my mind started turning things over. How do you treat supraventricular tachycardia? Adena-beta calcidage, adena-beta calcidage. And I was just saying this over and over in my head. I can say a lot better in my head. But I'm just saying it over and over. So it's adenosine, beta blockers, calcium channel blockers, and digoxin. And I'm just saying, adena-beta calcidage, and I'm just doing it over and over again. I was thinking about digoxin toxicity levels and lithium toxicity levels, and, onset peak and duration levels of, all of the insulins, which is, by the way, 15, 33, 1, 2, 4, 6, 8, 10, 12, just in case you're wondering. And and then I fell back asleep for a little while, and my alarm went off. So I showered, I got up and did my normal morning routine. It's really important, I think, for people to kind of get into a morning routine and have that good sleep hygiene, not just going to sleep, but also waking up. I got a little protein. I think I made some chicken the night prior, so I just, ate a little bit of chicken and a donut just for a little bit of sugar rush. And I also had a Rip It. And if you don't know what a Rip It energy drink is, this is the stuff that we had in Iraq. And it always makes me a little bit nostalgic and a little bit happy. So I had at least one of those on the way. So I drove to the site. I tried to stay relaxed. I was still a 15-minute drive away. So I tried to stay relaxed, while driving, even though people were driving like idiots and like they hadn't had enough coffee yet that morning, and they probably shouldn't be on the road if they hadn't. But I tried to stay calm and collected, and I'm listening to a podcast, just to stay engaged. And, and so probably I want to say, I want to say that I took my UWorld assessment about, I think, 6 days prior to my NCLEX date. So I took that, and I felt like I did crap on it. but I did well. I think, let's see, I think I had 20 minutes left, and I had like 40 questions, so I was taking it really slow. Because, again, if this is the first time you're listening to the podcast, I failed my first attempt, and there was a reason. The main reason is that I rushed the exam. I am 100% sure I didn't read anything twice, and there's a good chance that 75% of the questions that I got, I probably didn't even read all the way through once. And it's not unfair to I think to say that there's probably a lot of us who are good at testing, or at least we're good at testing in like Pre-Reqs, where you're kind of used to the type of questions you're going to get. And so, you start reading the question and you're like, oh, I know what this is about. And you look down at the answer choices and you're like, yep, that's the one. And you just pick it and move on. And with the NCLEX, you can't really do that. And so that's what I did. I rushed it and, moved on. And so I think I was done with the whole thing in like 45 minutes. It was way, way, way too fast for me. Some people are really fast test takers. And if you are, and it works for you, great. But I should not rush. And I did. And I failed my first attempt. So just a little, backup. So I'm listening to the podcast on the way there. I don't think, I probably only did 100 questions total in the last 5 days. In the last 5 days, I probably only had, 100 questions worth. Otherwise, I was just, reviewing rationales. I was listening to some important lectures. I was doing some other stuff. So that's what I was doing. And I was listening to a podcast on the way there just to stay engaged, because I wasn't doing questions and stuff like that. I was just listening to podcasts and just kind of absorbing stuff. So I got there and I went through my flashcards. I had brought out a very small selection of cards and just flipped through them once. I know you're not supposed to, and I know that you're probably not going to learn anything in the last 5 minutes or the last hour. If it's not there, you're not going to learn it. But again, it's just whatever you have to do to stay calm, you just do. I think as long as you realize that last hour isn't study time, it's anxiety management time, then I think you're going to be okay. But if you if you think you're still going to study the last hour before the test, you probably shouldn't be there. So just know that the last hour before the exam isn't study time. It's anxiety management time. So I walked into the building, I parked, I walked into the building, and there was already a line in the office, 3 or 4 people deep. And the process was familiar, again, because I'd already been through this. I got my picture taken. I did not smile this time. I got my palm scan and, boom, into the test. I took a quick stretch break every time I felt myself rushing. And again, if this is the first time you listen to this, I rushed the last one. So anytime I felt I felt like I was rushing or feeling impatient to move on, I stopped, and I'm still sitting in the chair, because if you stand up, they're going to rush in like you're cheating or something like that. So about every 10 to 15 questions, I would just push back from the table a little bit, take a breath, it's going to be fine. Maybe yawn if you really have to. Every 10 or 15 questions. And then I got to 35, and I felt like I got to, I got to go. I got to go to the bathroom. So I raised my hand and went to the restroom, walked around outside for like 2 minutes, took a couple of sips of water and, right back in. So I was probably only gone for 5 minutes or something like that. But just that little break, I felt a lot better in, and it's okay to take breaks. I think one of the other big differences between last time, the first time I took the test and the second time, was that I was fully prepared to go all the way to 265. And I, despite the fact that I took a break at question 35, I was still, I think, I think I was still good for time. I was answering them slow and I was reading everything, but I think, I think I was still in a reasonable window of time. So when I got to question 70 or so, I was thinking, I should take a break. So, if it went beyond 75, I felt fresh and I wasn't, stressed out by getting to 75. And so I answered number 72 and the screen shut off. Instant panic. And, a little, it was like after, just like eyes went blank, just the instant panic, a little thing on the screen said, I was at a scheduled break and, would I like to take it? And, I was tachycardic at the moment. So I thought, I should probably just take the break. So, I just took the break, again, restroom trip, splashed some water in my face, went outside, got a breath of fresh air. And, I went back in and it shut off at 75. So the last 2 or 3 questions were all SATA, select all and apply. And I felt really comfortable with my answers in the last 2 or 3 questions. So, the nervousness never stopped. The anxiety through all the way, it maintained it all the way through the test, all 75 questions. And I think actually that probably helped me because it kept me focused and humble, which was not something that happened last time. But the last 2 or 3 questions were SATA, and I felt really comfortable with my answers. And by the way, I know tons of people absolutely hate SATA questions, and they can be really tough. But honestly, especially like if you're preparing for the NCLEX and you have NRSNG and you're doing one of these SimCLEX exams, and knowing that people who pass generally have a lot of SATA questions, I kind of came to like them. And I felt like I was able to more completely answer questions rather than just choose the best of a bunch of bad answer choices. Because that's what it always felt like to me. Like, in a multiple guess or a multiple choice question, the NCLEX style questions always seemed to me to be, a choice between a bunch of wrong choices. So you're not choosing the most correct. Like, I never felt like there were 4 correct answers and I had to choose the best between 4. I felt like there was 4 incorrect answers and I had to choose the least incorrect of the answer choices available. And so with a SATA question, I really felt like I was able to actually choose correct answers. And more than one, meaning that it was like, yes, it's this and also this and also this. And I, and that I came to like them because of that. So anyway, so I finished the 75 questions and, the research section came along, and here's the thing. I know it wouldn't matter to my score if I ended the test right there because you have the option. Usually, if it comes up, you should be able to go over to the left and, end exam. I could have, and that's what I did last time. And, it doesn't have any bearing on your test results. But I wanted to make sure that I did everything different from my first attempt. So I did the whole thing. And which also doesn't make sense to me, though, because I think at that point people just want out of there. So I think that, a bunch of, I would think that a bunch of people who are just wanting to get out of the test are just clicking through. So I really tried not to because, again, I just wanted this to be completely different from my first attempt. But there were a couple where I just didn't care, and I just clicked stuff to be done. I admit it. So I get done, raise my hand, get escorted out, and I'm standing there for a few minutes, much longer than it took me to get out for my breaks. And, the lady looked up at me, and she says, the system is down. Instant panic. So I was like, oh my God. And so I'm just looking at her, and I can feel the sweat running down my back and like forming on my forehead. And she says, I can't log you out. You can just wait out in the waiting room, and when everything comes back up and running, we'll sign you out and you can go. So I sat there. And I sat there. And I sat there a little longer, and then finally, after what seemed like a really long time, the clerk says, you can just go. I'll file a work order saying that we couldn't sign you out. It'll be fine. And of course, what's my concern? Will this affect my results? Will this affect whether or not it even saw that I took the test today? Will this affect when my results will be available to me? All of that kind of stuff. And she's like, oh, I've been here for like 15 years. It's not a big deal. And I was like, I 100% guarantee that you have never, ever, ever in your life followed up with any person who's taken the test if this happens and whatever else. So anyway, walked out, got to my car. I'm not even really sure that I checked my phone, to be honest with you, but got all my stuff together and drove home. And no sooner did I get home than I received a phone call from my mom that my grandpa had taken a turn for the worst and he didn't have long. So I drove up to the VA hospital. I'd seen him probably 5 or 6 days prior, so I think the day that I took my assessment is the day that I drove up to see my grandpa. And at the time, he had slowed down, but he was still there. The man before me, the day that I took my test, the afternoon that I took my test, was gone. It was less than 24 hours from that time until he died. And I don't need to set the scene for many of you who've been a parent, or who've had a parent or a grandparent or a loved one die, and you've been there. The breathing is what signaled the end. His eyebrows unfurrowed, and he was gone. My grandpa was a World War II veteran with multiple tours on the USS Feckler and the USS Stormer, and he was one of the last tin can sailors. And then, went home that night and got there the next morning, and the day that I found out I passed my exam is the day that Grandpa died. So it's a really weird feeling to be done. And this last week, it seemed to be a week full of loss. And not all of it, was bad. First and foremost, I lost my grandpa. He was a powerful man, and many people loved him. He was also very stubborn and, is going to heaven to see his first wife, his second wife, his younger brother, and his youngest son. And, all of those things were heavily on all of our minds, the day he passed. But maybe less obvious is that I don't know what to do now, or at least I didn't. I still had my job, so that was all in place, and I just had to wait for my start date. But for more than 8 weeks, beginning to end, my sole purpose was to study for the NCLEX. And, obviously, I'm still a dad, so that doesn't go away. So that wasn't, I guess, my sole purpose, but, all the normal functioning stuff. But, my sole purpose, I knew that every morning after I get my kids to school, I was going to go down to my study dungeon and work on NRSNG, UWorld, Kaplan, Saunders, Mark Klimek, and so on. And now what? I went to at some point, I think, after I finished, I went to the hospital that I'd been working at for the last 3 years. and I cleaned out my locker. And it was, it was weird. Like, it was really weird after so long. And then all I had to do was wait. So the question is, now what? I have my PALS book. I have ACLS coming up kind of towards the end of the month. I think this week or next week. I can't remember. And I have my TNCC, or my trauma nurse course, starting pretty soon too. And I'm really looking forward to that, actually. So I'm feeling a little trepidation about starting as a nurse at a new hospital. I've already done, if you guys have been following on social media, I had started and I had 2 days of orientation and then my first day as a nurse at the hospital. And, I think there was a lot of confidence that I could draw upon while in my job as a tech, in that I knew where everything was, and if something goes down, I knew where to get the stuff that we needed. If I saw a nurse looking around, in a certain situation, I knew what they were looking for. And so I could just boom, Johnny on the spot with this, that, and the other thing, and I knew what they wanted, and I was like, boom, 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 here you go. And I was just, I was that guy, and I could be that because I knew where everything was. And the doubt kind of creeps in, when I'm in that situation, will I know what I'm even looking for? and hopefully there's going to be a tech there who sees the confused look on my face, or hopefully another nurse sees the confused or kind of lost look on my face, in this first year, and they'll be like, boom, just hand it to me. And I'm like, yes, this is exactly what I needed, so, hopefully that's the deal. And some of you saw the post about how my first shift went. And I really appreciate you guys interacting with, the Instagram feed and the Facebook page. It's a lot of work to do all that stuff, and I want to make sure that I'm doing stuff that matters to you. And so as you react, that to me kind of signals that I'm doing stuff that's noteworthy or important or interesting to people, or, interesting to more people than just me. And I'll just talk about one thing about my first shift in the hospital, because some of it I've already talked about through social media and stuff. So I made a statement that it's really easy to see how new nurses can feel very overwhelmed when faced with the actual job. And yeah, I got I got 2 of the first 3 IVs, and the one that I missed was one that 2 other very experienced nurses were not able to get in their first or second attempts. And yeah, I felt pretty good about that. But that hardly seems noteworthy now. It's not dismissible. It's a very important skill. But what seems to stick in my mind is how much I don't know. There's so much to remember, and and just doing normal job stuff. Charting, that's a normal part. It's not, charting is not even when you're in the heat of the moment or you need to do something important for the patient. Just being able to chart the things that you know how to do is totally routine and stupid. And there's so much stuff that I can't, I have to use so much of my brain to even remember how to chart, because ER charting is very, very different from med-surg environment charting, and this is also a much larger ER than I had been working in, and I can't tell you how many times I just in that first day, I can't tell you how many times I just seem to take I'm just walking around, taking an extra lap around the ER, because it's shaped like a weird figure 8, but with several tentacles going out in offices and extra exam rooms, and where the med rooms are, and all that kind of stuff. So it's just don't mind the new guy, just taking another lap around, just familiarizing myself with the place. And it's okay to feel a little bit stupid, I think. But one thing I really appreciate about how this ER functions, and probably it's nothing new for those of you who worked at a large ER, now or prior to getting your RN, but they have like 4 patient pathways. And when the system is working, it really improves the efficiency of the department. So, of course, when things go sideways, there's no system in the world that can efficiently manage the golden horde, so to speak. But anyway, it was really cool. And I think one of the best features of the system is that there is a provider, a tech, and a nurse running triage. And when someone just needs a swab or something quick like that, they can come in, get what they need, and are out processed. So it's kind of like having an urgent care that less serious things can get filtered through, and I think that's really great. It's also something that I've really tried to advocate for in my old ER, just triage. Someone trained to evaluate the needs of incoming patients rather than hoping that the registration person out front can correctly communicate the difference between chest pain, and chest pain due to, like, bruised ribs. Kind of an important distinction. But anyway, I think by lunch, the first day in the ER, I needed a break from going through the orientation material. I started zoning out quite a bit. But when I said that to my preceptor, she just laughed and said, yeah, we'll take a break. We'll change gears in the afternoon, And it was a really great feeling knowing that there was mutual respect from another nurse. And yeah, even though I'm wearing blue scrubs instead of the teal, for my system, the system that I'm in, all techs wear teal, which I always thought was like the ugliest color, or eggplant colored scrubs, as a nurse, because that's the color that my school wore, which I quickly learned were actually the ugliest color scrubs for me to wear, but I didn't feel different. Like wearing the blue scrubs, I really thought that I'd feel a lot different, but I didn't yet. And I suspect that even when you're an experienced nurse, you're going to feel like you don't know enough, or there's going to be some major event that even an experienced nurse hasn't dealt with before. And I guess I kind of think about it like the first. Do you guys remember when you first started driving? And maybe it's a little bit different for the younger crowd, but for those of us who are in our 30s or older, when you first started driving, and I'm not talking about the farmers, who've been driving since they were like 10 on tractors and stuff like that, but normal people, driving for the first time, especially those of us who had to learn on a stick shift. It seemed chaotic, and remember how much, it seemed like there was to think about. And it's no big deal. Most of the time anyway, it's pretty easy. We don't have to put a ton of active thought into it. It's more kind of autopilot. So if you're starting new, like I am, even as an experienced tech, there's so much to think about and learn. And right now I think it takes like 80% of my functioning brain to chart something, where in a couple of months I'm sure it'll be second nature, and I can apply my my focus and my concentration in other areas where more growth is needed. So I know I say it a lot, but give yourself some grace, give yourself some time, give your coworkers some time to get to know you and trust you. And again, give yourself time to get to know your job and trust yourself. Okay, everybody, I hate to do this, but I've been trying to get the 2 remaining winners to contact us to claim their Badge Lady by Nerdware Badge Reels, and I have been unable to do that. So I am going to draw 2 additional names. Let me just get my very expensive Diet Coke box with all the names in it from the week prior. So, all right, so I'm going to draw 2 additional names here. All right, here we go. So from Instagram, Allison Sutliff. Allison Sutliff. You are the new winner of one of the Badge Lady by Nerdware badge reels. And the second person, let's see, Angelica Pillman. And I didn't write down where she was from. Angelica Pillman. So I don't know. So I'll have to look it up again. But Angelica Pillman and Allison Sutliff from Instagram and or Facebook. You are the new winners of the Badge Lady by Nerdware badge reels. So here's the deal. You have your name drawn. I will send you the badge reel from, again, Badge Lady by Nerdware. You need to contact me at realtalknursing@gmail.com or use Facebook Messenger or the Instagram Messenger and let me know your address, and I will send these badge reels out to you as soon as possible. It's first come, first serve, so if you contact me, I'll let you know which ones I have left, and you can choose what you want. But you better write in fast. So like the page, keep sharing with your friends and classmates. Please, please, please share them with your classmates and underclassmen. Thank you so much to everyone who liked the page and shared the post and continued to interact with us on the social media stuffs. It truly means a lot to me that you're spending your valuable time with us on the podcast and on Facebook, Twitter, and Instagram. Don't forget about Ben and Greg Show, the Shift Report podcast, which you can find wherever you download podcasts. And they're also on Instagram. Check them out on Instagram. So there we go. We have the two names again, Allison Sutliff and Angelica Pillman. So let me know how you guys are doing and write into the show. Give me your addresses, and we'll send these badges out to you. Thanks so much, guys. It was awesome being back with you today. Thanks for listening and helping me keep this podcast going. There's more to nursing school than just content. Remember, in nursing school, the only easy day was yesterday, but we can get through this together. This Real Talk School of Nursing podcast is a Real Talk production. This podcast is dedicated in loving memory of my Grandpa Smith, one of the last tin can sailors. Fair winds and following seas.
Sic semper tyrannis, facta non verba.
Good night, Steve Cannon, wherever you are. Annyeong kasayo. Now you go home. The Real Talk School of Nursing podcast is a holy moly, I can't believe you're still listening to this podcast.